Hi, I'm Dr. Claire Smith. I'm a pulmonary and critical care specialist at LMH Health. So pulmonary and critical care is really a team sport. I like that you get to not only be on a level playing field with your patients, but also every provider who comes to the bedside, including your nursing colleagues, your therapy colleagues. Really everyone is hand in hand taking care of the patient the best they possibly can. Patients often complain of shortness of breath or cough, and that can actually be a lot of different things like asthma, COPD, even things like chronic reflux, sleeping disorders. Sometimes we find pulmonary nodules or immune-related diseases like interstitial lung disease or hypersensitivity pneumonitis. I love airway disorders, so things like asthma and COPD, things that don't always affect your life, but when they do, they're just an absolute roadblock. And I like helping us try to pick and choose the different risk factors that we can work on to get you feeling good more of the time. I guess my philosophy of care is the care that you want and will come receive is what's best for you, and that's what I'm happy to try to facilitate. I think a lot about synergy and how we're better together, so I want to inquire about what works for you, what are we trying to achieve for you, and use my medical knowledge to help us get there. So I describe my practice as largely based on the individual and what I sense and ask from you that you're interested in. If you want to make small incremental changes using like the scientific method to figure out what's most helpful, we will absolutely do that. But if you are interested in trying something radically different, we can also do that too. The first visit, I'm going to ask a lot of questions. I know you're coming to a lung doctor, but I don't just focus on lungs. I want to understand all of the exposures you've had in your past and the risk factors that have led us to where we are, and also what might prevent us from getting where we want to be. One piece of advice I have is if you're between the ages of 50 and 80 and have a history of tobacco use disorder, you should probably discuss with your doctor getting screened for lung cancer. We do this with a low-dose CAT scan, so we minimize the amount of radiation you get, but you still get a really good look at the lungs, and if we find any kind of abnormality, we'll handle it. One other piece of advice I have is not to downplay when you do get flares of your asthma and COPD. We know that every time that happens, your lung function gets just a little bit worse, so what we want to do is really prevent them from happening in the first place.